Hello, just want to update um, whoever watches these. So anyway, I got I don't remember even what I said last time, but I got a lot of problems all over my body, like elbows, knees, shoulders. Like raise my arm above my head. It's man, like right here, it really fucking hurts. like right where the muscle attaches to the bone, I can feel the tendons, and it's like I was just doing arm circle. I can't do it with the other arm anymore. But like just arm circles, just kind of warming up outside when I was going for a walk. And then this over here, I felt something like tear, and it felt funny, but it was fine. But then later on, it started hurting. That's like a month and a half ago, and it's just been doing that. It's just been getting worse. My hip has been bothering me. I think I mentioned that before. Elbows. Um, my hand is like you can't really see, but I guess you can kind of see. See on the right where I'm touching my thumb, it's like there's like a lump there, and it's not just like a muscle, and it's definitely or yeah, and it's just a lump. Maybe I can do this. Okay, so like all that through here is this like solid mass, and it's spreading. Like it was just this strip, and then now over here it's starting to form another one here. Um, I mean it's sore, um, and I don't know what that's about. I was laying down on my hand, like on a fist, like this, on a bed. So my hand was had some pressure on it, and then the next day I had that. And my mom has it. My grandmother has it. Actually, my grandmother had it and it went away. My mom got it, like I don't know, 10 years ago. She still got it. Um, so thanks, mom. And and my dad told me he started getting arthritis when he was in his 20s. And my right finger, like when I try to hold a pen, it hurts so bad. Like sometimes I can't even hold a pen. Like I can't write. So I got all these connective tissue problems all over my body. And I say connective tissue versus just saying joint because like I can like feel the tendon when I rub my finger over it. And that's not so much like in the joint of like the socket in my shoulder. That's just tendon. The ligaments in my spine obviously are part of the joint, but they are damaged. But like the hip, any um, any soft tissue in my body seems to be easily injured. Like my muscles, fine. I can lift weights. I can do whatever. The muscles work great. The connective tissue's weak. Like even like leaning back. Like I was just leaning back because I didn't have a headrest like my other chair over there does. But I wasn't sitting down. I was sitting this. I was leaning back and like watching TV or whatever. I slightly leaned back, and the right where the muscles attached down here was it? It's like right here, where the neck muscles, right where they meet your clavicle, right in there. Like became really tight and started hurting bad. Under my chest right here, right under the pec, it was just like I was doing some rows where you reach forward and you pull the you pull the weight back like this, but with both arms. And as I was doing that, my chest was stretching some, and like I felt something tear there. So yeah. Anyway, you get the idea. I think I've been having all these problems. So now I talked with Dr. Centeno and Dr. Schultz in Denver, and they want me to do PICL, but Dr. Schultz wanted me to try doing the posterior stuff with Regenix because he said the PCAL stuff is kind of sketchy. Like they don't have the kind of training. They can't go doing like there's little small gaps and small ligaments in the joints of the in between the vertebrae, and he imagined because you're requires a lot of training to get in there with imaging and not hit nerves and veins and arteries and stuff. That they probably didn't do that. So he'd like to try that C1 through C7. Although it was weird because he told me like everyone has like C1 rotation. I'm like, my C1 rotation's bad. It's like worse than anyone's ever seen. 8 chiropractors told me it's the worst they'd ever seen in their whole career. Like 8 upper cervical. All they do is work on upper cervical. Well, 7 of them are upper cervical only, I think, and then 1 was general, but also did upper cervical. So anyway, they all said I was the worst, and for my C1 rotation, and I think it was about 18 degrees. And the only people I've met that had it worse are on the Facebook BICL group. And the only people I've ever met, talked to hundreds of people that have rotated C1, C2. Only people in that group are the only people. So the odds are is that this posterior stuff's not going to work. It's not going to fix my alar and transverse ligaments because they're too far gone. Like he was saying, hey, it might stabilize like the other stuff, but I'm like, great, that stuff's stable. But what holds your C1 in place for the most part? The alar and transverse ligaments. Like it's still going to be forward. It's still going to rotate. But I mean, he said that most people, like the Regenix guy said, the doctor said that most people that he sees don't end up having to get PICL, but also most people he sees probably don't have a C1 like mine. And I'm not sure he keeps track of their rotation. He should, but none of these doctors do. I don't think. I don't think they do it in Regenix in Denver. I don't think they do anywhere. I mean, it's absolutely critical that you would keep statistics on C1 rotation and C1 shift, meaning like if your C1's like this and versus like you being flat, and then how rotated you are. It's critical, absolutely critical, if you're going to keep stats on patients that you're working on for regenerative therapy, that you say like this patient was at 10 degrees and then we did regenerative therapy and then they got more x-rays a month later and now they're at 5 degrees or something like that. Without atlas orthogonal help, without whatever, it's fine if you need to do that as a patient. Maybe that will mess up the results some because not you're doing 2 things rather than just the one. But you could do the one. I mean, pay for their x-rays. It's worth it to know, to say like, we're injecting here, this is fixing that problem. So then they could say to people like, hey, if you have this severe of rotation, then you're gonna need PICL. You should probably get it because those alar transverse ligaments are probably gonna be damaged or whatever the data would show. But like, they're not tracking it, so. If I ask Dr. Centeno, Dr. Schultz, or whoever, anyone at Regenix, does anybody have these stats? Nobody's going to know. And it's like, are you kidding me? Like, that's literally what you're trying to fix. You're trying to fix vertebrae. You're not keeping track of how they're aligned. After people will be like, oh, the neck curve is better. But it's like, well, I guess so. They will look at it, the x-rays later, and be like, it looks better. But it's like, why wouldn't you measure it and say, it's 5 degrees better, it's 8 degrees better? Because then that matters. Like, if you're saying like, okay, now this time we used PRP, this time we used a different kind of PRP, this time we injected the facet joints and these live joints and whatever, and then we got even better result, or we got a worse result, and you're talking about like a few degrees, which an upper cervical chiropractor can examine and figure out, but nobody's measuring that, and it's like you try to get doctors to talk to each other or something like that, and it's like, the only place I know that does collaboration between chiropractor and regenerative therapy people is, and I'm not saying like no chiropractors work, like up in Denver, they have chiropractors that work not at the place, but like you can go see a chiropractor nearby, and like frequently patients do for upper cervical stuff, and but it's not like, I don't know if like what I was saying, they're getting the x-rays, they're going in and they're getting the stuff, and then they're coming back a month after later and getting x-rays and then calculating the neck rotation. I mean, patients don't even. I talked to a lot of patients and they're like, I have no idea what my neck curve is. I'm like, how do you not know how much? I went to 8 upper cervical chiropractors and they all told me what my neck curve degrees were. So that's frustrating. And then I was told that it didn't really matter if my internal jugular veins are compressed at all. It doesn't matter. And I'm like, well, it does, because that's stupid. So we're just right there, just cut you off. That's stupid. If your veins don't work anywhere in your body, it matters. How much it matters, like if a vein in your leg isn't working properly, then maybe the blood will find some other way to drain and it'll be all right. Probably should have it looked at, but it'd probably be fine. But it's like we're talking about like right up here. It runs right up next to my ear, so collateral veins are even closer to my ear. Like it doesn't. The IJV doesn't run right next to your ear. Actually, it goes up like right up the back of your throat and then into your skull. It doesn't really go out like this way. It doesn't really poke out so much that way. I mean, it touches your C1, and your C1 isn't that wide. It's about as wide as your mouth. So, anyway, the collateral veins I have, I got a CT catheter venogram when they put the venogram like in my wrist and ran it all the way up through my neck. And they pumped a bunch of contrast in me, and they found collateral veins were like all like just I don't know like a centimeter deep in here because they like branched outward like this way and then drained downward from that on the right side, and I imagine that's what I'm hearing in tinnitus. The left side is what like if I push on the back of my ear here, I can feel pressure. Like was it? I can feel like a like what well it's weird because it makes that ear flex when I push on this ear here. So I put pressure here. It's I don't know if that has to do with the blood flow. But so I have those collateral veins of tinnitus associated with it. Exercise still greatly reduces tinnitus. Anything that increased my heart rate. Um, and I do have more of a loud, consistent hiss noise after doing prolotherapy and PRP. But it's harder. It's not so bad. Like if I go outside, I can't hear it. The hissing part. Like if I'm watching a movie or something, I can't really hear it unless it's like a dead quiet scene and I try to listen for it. And at night, tinnitus still gets worse, but it doesn't get as bad. It used to just be like whoa, 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 like just that loud. Just my right ear, my left ear might be like wow, 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 and it was pretty hellish. I mean, it's been a year and a half. I don't think a day goes by where I haven't wanted to die. So there's that. People say it gets easier, and I'm just like, I guess. For me, it's like getting easier at a glacial pace. But then it's scary too because like if that's all I had was tinnitus, like just the C1 problem tinnitus, but it's like I got these connective tissue problems where I keep getting injured more, and then and doctors don't know what's going on with me. I'm looking to get genetic testing for ehlers danlps syndrome. I'm not hypermobile at all. Um, just as stretchy as the next guy. Normal amount of flexibility. If I don't stretch, I get stiff. If I stretch, I can get more stretchy. But like if I go do yoga, I don't do that now. But when I would do yoga, um, I couldn't do more than average person. I was just average. So yeah, so I got a regenerative therapy I got to do in Tampa or Orlando. I don't know where they'll see me, but it's like $4,200 for one session. Whereas peak costs $300. And then so it's like and I don't know what I'm gonna do because I was just working a job and I stopped because I didn't really like the manager. Thought she was pretty ass at the job. She created an atmosphere of fear, which is like stupid. I mean, all the employees are afraid to say the wrong thing and afraid to make mistakes. And I'm like, we work in IT. Like, if you're not making mistakes, you're not working. Like, and that doesn't mean like it's cool to make more mistakes. You want to reduce them, but it's like it was like my first day, my second day, and she's like jumping on my back about shit, and it's like telling me I'm like spacing out. I'm like telling her like I'm literally taking notes on like everything that people are saying, and I'm trying to pay attention to all the new stuff, and it's like you're going too fast. And I'm not an idiot. Like you're looking at a straight A student. Like if me and her took a class, I guarantee you I'm getting a better grade than her. It doesn't matter what it is. Climate dynamics, wood shop, doesn't matter. I'm getting a better grade. Like I'm not a fool. That doesn't mean I'm a genius. Like if I take an intelligence test, like I always test average. But I love to learn. I love a lot of like we all do. I think we all love to learn. Like we don't like if I give my grandmother an instruction manual to like how to operate a complicated machine, she's like, "Oh, this fucking sucks." But she'll watch the History Channel and learn all sorts of interesting stuff. Like, it's something's interesting. We like to learn about it, and I find a lot of stuff really interesting. And I don't know, something about being a manager. People get put in power, and they just gotta come down on people because they don't know what the fuck they're doing. I've managed people for years, and it's not that hard. You just you, you give them responsibility. You trust them to learn it, and if they're having trouble, you say, "Look, if you're having trouble, I gotta help you, but I'm gonna try to give you as much autonomy as possible, so no disrespect." And then trust them, and they'll work their ass off for you if you treat them with respect. But being an asshole, it's like okay, like maybe probably because that's how your parents raised you. That's your management style because you don't know how to be a human. Although maybe that's what being a human is because everyone fucking does it. I mean, how many managers are decent? I'm a very good manager. I never meet people like me that are decent at it. I don't know why, because like I didn't try that hard. I just gave people work and was polite. That's it. It wasn't like we're crushing it as a manager. I just didn't do horrible shit. I never wanted people to be afraid. That doesn't mean that everyone always liked me. Sometimes I'd be like explaining stuff, and they're like, I'm over explaining it and too much, and they're like, okay, I got it, Brendan. Like Jesus, fucking Christ. Um, and I'm like, I'm sorry. Or sometimes I correct people, and it's like, I should have let them do on their own. But it wasn't like people weren't afraid of me. People weren't like, oh man, I got to go to work today, like intimidated or stressed. It was just like, yeah, it's cool. It's okay. It's fine. Um, and I got people to do things and learn things that were very difficult because I said, we need help with this, and I can't, can you try and figure this out? And it's okay if not. I wouldn't put people in charge of like major stuff and they had no idea how to do it. I'd run them through like making sure they were comfortable. If it was like a serious thing, like if you're doing open heart surgery, you can't just wing it. But um, but I would try to let them do it, learn stuff on their own, and then they love that. And like approach this your own way, because when you give people the autonomy to say like I'm gonna solve this problem my own way, well now it's not a chore. Now it's exciting. That's just like basic teaching education. Like teachers would do that, but God forbid you got a boss to try and do that. Like I don't know. So many bosses are gross. Just I don't know too, and we all get treated like shit. All of us. All of us have been shit on so hard. So I'm kind of like, how do you not know how to be a boss? You just don't do what they did to you. Like don't be that fucking asshole. And people might say, oh, sometimes you gotta be the asshole. I'm like, you can be polite and tell people that they need to do things differently. You don't have to be an ass. And sometimes people will fight you on it, and sometimes you have to put your foot down, and then you're a jerk because you're like, okay, well, somebody has to make the final decision. I'm more experienced, and sometimes you're wrong. So anyway, back to my health problems. So I lost a job, so I don't have the money. So I'm like, what am I gonna do? I don't have $4,000, so I gotta ask my grandmother, who I'm taking care of now. At least I'm doing that. She fell and broke her hip, and yeah. I wanted to say I'm doing sled pulls for my knees because, like I was saying, the rest of my body's falling apart. So watching knees over toes guy on the internet, and I think it was Joe Rogan he was on or something. He was doing sled pulls, and he was worse than me. He could barely run at all. Although I started to get bad, I could barely walk. Like I get up in the morning and I would limp, and I'd go for a walk around the neighborhood and I'd limp the entire way. Like I could not walk properly. I was like, do I need a cane? Like I can't. It's ridiculous. Like I'm in constant pain. I can feel like this tendon wrapping around my knee in a weird way. It feels like a rope on the inside of my knee. It hurts. Um, so anyway, I started doing sled pulls and sled pushes at the gym, which is really scary. But God, I was happy to do something physical. I mean, that's my whole life is just being athletic every day. Um, Not like extreme, but just doing like going out for a jog, playing, shooting some hoops, playing soccer. Never really killing my body swimming, but just doing stuff. You know, lifting weights some. Yoga I did all every week. It felt so good to be able to do something. So that helped me get through it. But I was afraid because I was like, I don't know, it's going to affect my neck. And the left side of my neck was a little tight, but then it was okay. My knees hurt for a couple days afterward, and then it started to get better. And then I could walk. So, like, I've been walking around without much pain just after 2 sessions. It's crazy. Just doing sled pulls and pushes. Did more pulls than pushes. Probably like went about maybe 30, 40, maybe like 30 yards. So pull 30 yards, turn around, pull 30 yards, do that like back and forth like 4 times, like pulling and then pushing forward like back and forth like 2 or 3 times. And it's really helped a lot. I think I might be looking at stuff for my neck to try and strengthen my neck. Because if it could help the same way it helps my knees, but I'm scared because I'm scared of making it worse. I'm scared of making the tinnitus worse. Although my right internal jugular vein shut entirely, so like I did the catheter thing where they were trying to put contrast down my vein. It didn't go at all, just not at all. And my left vein is like 80 greater than 80% stenosis, and it went somewhat. It was still a small vein, but it still works sort of. And the tinnitus isn't as loud on that side, but it's still there. Um, I don't know, it's just a nightmare. I mean, if I could work, that would help a lot. Because I don't know, it gives me something meaningful to do. If I could find a non toxic workplace. But all I can do is work from home because I can't work at places. Because I can't have like a custom sound environment, custom seating. And I have to do things like I have to take breaks and stand up and stretch and go out and walk around and then come back. I need access to maybe some ice or uh, whatever, all the medicine I have, supplements. It's just difficult for me to work at a place because they want me to be able to do some physical things, and I don't know. It just seems like I've set myself up for failure with all the tinnitus. Mostly the tinnitus. If I did the tinnitus, I'd be like, yeah, I could go work at a place, but it's a goddamn nightmare sometimes. And trying to like listen to people talk to me randomly, I just have to tell them like, no, I can't talk to you, and I have tinnitus. I didn't even tell the last place I had any health problems because I told them I injured my neck a while back, but that's it. Um, and but it's really hard. Like today, in the morning, before I quit, I was trying to focus and I was trying to work. I was doing the work fine. I was focusing on what I wanted to and doing well. Um, Everything I wanted to do, I was able to, but it was hard. And tinnitus was screaming. I was so stressed. When you're stressed, it makes tinnitus worse. Oh, that's just such a nightmare sometimes. Because it's like, there's so much I can't do. So many things I want to do. I mean, how I made friends before was all physical stuff. So now I'm like, I don't know what to do. I mean, maybe I could try some light dancing at the bar. There's some stuff, some salsa dancing. If I take it easy, maybe. Board games are difficult because you're like leaning over, like reaching for cards and stuff. I can wear a neck brace when I do it, but still, it's difficult. But I don't know. Maybe if I strengthen my neck, that's my hope. Like maybe I get the iron neck. Of course, that's like $300. I don't have. And yeah, so I basically have to see if my grandmother can help me with the posterior stuff because they require that I get that before I can get PICL, which is like the only thing that can possibly help me besides a fusion. I mean, it's tempting to go into a doctor and just be like, look, man, give me a fusion because the insurance will cover that and just be like, look, you see where my C1 is? Fucking move it back. Move it where it's supposed to be. Screw it in. Okay? I don't give a shit. Just make it get off my goddamn veins. But I'm afraid of that because it's like, you can have complications from that. I could have neck pain for a year. I've seen people get fusions and it's just bad. I mean, the level of incompetence that I encounter with most doctors, like the things that they do all the time, they're good at. But there's some nuance to the conditions that I have, and they don't want to spend 5 minutes learning something new or thinking about it or hearing me tell them about it. They don't want to collaborate with other doctors. They just like, you get two doctors that like know you real well. I'm like, can you guys talk to each other? No, they won't do it. They won't do it. They won't. They won't call each other on a cell phone. Like, hey, so he's having this. What do you think about this? They won't do it. I mean, how childish is that? Like, if you're fucking doctors, like, you have cell phones. Do you want me to conference you in? Like, call the, call them. Like, call it. It's not hard. Like, my doctors won't talk to each other. And it's like, it's weird because, like, in cybersecurity or whatever you work in IT field, like, you talk to people, your coworkers, and you say, hey, like, you might have someone as a voice over IP specialist or network engineer or system admin for Windows Server or whatever, and then you're not. Maybe you work in network engineering, you talk to system admin, you say like, all right, so what do you think about this? And then you talk and you figure out a solution. Doctors, it's like, sometimes they just like, no, I'm sure they do collaborate, on Facebook and, personally on the phone and via email. I mean, there's people around the world who are collaborating to help each other. But a lot of doctors are just like, no, I can't talk to another doctor because I'm an introverted nerd who tries to act really hard all the time and has a massive ego for reasons unfathomable to me. Um, so, I guess I'm a nerd too. I mean, I sit in front of a computer all day and I play video games and I'm in IT. So if I'm not a nerd, who is? Even if I am very physically active or was. So yeah, that's what's going on. It's pretty fucked up and it's pretty scary. My quality of life is pretty shit. I'd like to go a few days without wishing I wasn't around anymore. I'd like to be able to tell people that without them telling me, trying to commit me. It's crazy, man. Like I called for insurance today. I was like, oh, damn it, the fan stopped. And the tinnitus gets so loud. My computer fan. Oh my god. Um, sounds on my computer or something. I called the. God damn it! I can't even think when this shit's happening. Okay. It's such a nightmare. It's just such a nightmare. And I just keep hoping one day I'll wake up and I just never do. Yeah, I call the my insurance because I'm like, can you guys give me a therapist to talk with? Because just to talk to somebody about this, because most people can't hear this, they can't handle it. So I call them up and I'm like, can you give me a list? And they're like, sure, like a list of local people that take my insurance. So I don't have to call people randomly and be like, hey, do you take my insurance? Do you take my insurance? I think they just give me a list of providers. So they said they emailed it to me, so I'm like, cool. They're like, let me ask you some questions. I'm like, okay. They're like, have you thought about hurting yourself or whatever in like the last 90 days or 30 days or whatever? I'm like, yeah. They're like, do you ever like just wish you'd fall asleep and not wake up? I'm like, yeah, like every day. Um, and um, and so they're like, okay, like we gotta transfer this other person. I'm like, well, you're gonna email me these things? They're like, I'm gonna transfer you this. I'm like, but you said you were gonna email me this list so I can talk to people, so I can not be so stressed about it. And I just refused because I told them. So I'm like, so I call them back, and I'm like, they just said this, went through all that again. They said we gotta ask you some questions. I'm like, I don't want to answer questions. I just want you to send me the list. So they sent me a list. I'm gonna call these people tomorrow. I'm just like, why can't I fucking tell people that I don't want to live? Like, it's just, it sucks so much ass. I mean, I get it. Like, they're like, oh, liability and all that. But it's like, if they had, like, thought about it for, like, 10 seconds, right? They'd be like, tinnitus plus inpatient hospital. Very bad. Very, very bad. There's no inpatient hospital for people with tinnitus because they take your phone. They don't let you have any white noise machines, any electronics, nothing. You just gotta sit there by yourself in the quiet with your tinnitus all day. Maybe you won't be by yourself, but it'll be quiet a lot. And it'll be hell. And then on top of that, they want to pump you full of SSRIs. And they make tinnitus so much worse for so many people. It's ridiculous. Like, if I take them, it's like 3 times as bad. I mean, it's hell. It's truly like, I'd rather you kick me in the nuts 5 times in a row than take an SSRI. Like, that's how hellish it is. It's fucking awful. I'd rather have a kidney stone. Just fucking give me a kidney stone and don't give me any pain medicine. I'll grin and bear it for 2 hours. I'd rather do that than deal with an SSRI. And that feels like someone stepping on your nuts if you're a guy. And if you're a woman, that feels like being pregnant. That's what women tell me. Um, so, like, that's the seriousness of, like, how much the tinnitus bothers me. And people are just like, just don't let it bother you. I'm like, I don't want it to. But it does. Because it changes constantly. Like, at any given time throughout the day, it's different. It's just going at a different pace, different sounds, different ringing, different hissing. All day it's different. So it's like, if it was just one sound, I'd probably get a lot used to it pretty quick. But it's like 1,000,001 sounds. They change all the time. So it's like, I think if you have sounds that are like that, they change a lot. They're different. They're not just like a solid like like that tinnitus sound. That's nerve damage. And it's like you had hearing acoustic trauma, or you have a problem with vertebrae in your neck squashing against the nerve. Then you have the E sound. when you have like the humming and the whooshing and the ringing, then you've got a structural issue. You've got vertebrae that are messed up, squishing on stuff. You got internal jugular veins that are compressed. Could be styloids. You got something in your brain that's like a vein or something that like needs a stent. Just some kind of vein or something in your head, somewhere in there, maybe in your neck. I guess sort of in your head region of your neck though. So I think like if you have like vertebral problems down here, they don't really like in the back. They don't really cause tinnitus so much. It's more like C1, C2 area. Sometimes C3, but mostly C1, C2. So just so you know, there's that. Yeah. So I'm faced with the money issue, which I don't know what I'm gonna do, because if I don't get better, I don't know how I'm gonna function in life and get money. And if I don't get money, I can't get better. And my body's connective tissue's all fucked up. That's not getting better. It's getting worse every day. I'm hoping to fight that with exercise, strengthen all the joints and stuff, which also can strengthen connective tissue itself. And I'm taking a lot of supplements like boswellia and glucosamine, and that's helping too. Like I definitely feel stronger in my neck and my joints since taking glucosamine, chondroitin, boswellia, and hyaluronic acid. It's hyaluronic acid, and I think there was something on. I think it's called the Cusack protocol. I was already taking these things anyway, but the Cusack protocol on Facebook and maybe on Google. I think it's on Google too for EDS, ehlers syndrome. Helps a lot of people with strengthening their connective tissue. And if you look on Amazon for these things like glucosamine, boswellia, chondroitin, and hyaluronic acid, like you'll see on Amazon reviews, like everyone's like, my joints feel so much better. As everybody, even if you don't have EDS, like so it helps everyone's joints feel better, stronger. If you're playing sports regularly, you should probably take them just because prevent injury. Unless you're allergic to shellfish. So I'm taking those supplements, and I think BPC 157, I think is what I'm also trying. BPC 157. It's called, yeah, BPC 157. I'm trying that as well. See if that'll help my joints, connective tissue be stronger. So I'm trying the supplements. I'm trying diet just to have like meat, fruits, and vegetables. That's it. No sugar, no soda, no nothing. Nothing interesting. Just that. And meat I prepare, not meat that's already prepared. So like no sliced ham, no nothing you get at the deli. Just meat section, fish, beef, whatever, steak. I prepare it. Salads I prepare. Like you get a salad at a restaurant. I don't know how, but they make it like 1,500 calories. But mostly it's just like I'm hoping to reduce any kind of inflammation. I'm also maybe looking into like I mentioned the genetic testing. Veritas, Veritas, Veritas.com. I'm getting genetic testing for EDS, and then might get mold testing because wasn't how I was my whole life. It just kind of happened. Like one day I'm fine, a couple months later this starts. I'm starting to have joint problems. 6 months later, I lift some heavy stuff, and then my neck's all fucked up, and then and then the tinnitus starts because my neck is squashing on all these veins. So it still gives me nightmares thinking about it. I mean, I had nightmares last night about previous times that were very difficult. Like, it's like I had such difficult times in the past with this. It's like I have PTSD about it. So that causes me stress, and then it makes the tinnitus worse. So that's what I'm going through, trying to live my life. And still going for walks regularly, at least for exercise, keeping the weight off. I'm not really gaining much fat. I think I'm losing some. I don't really have much to lose anyway, but trying to spend time with friends. But honestly, if I could not be around anymore, I just wouldn't, because I'm just tired of it. Tired of seeing doctors that don't want to talk to me, you know. I don't have any plans to do anything. I'd like to talk with therapist tomorrow, so we can just talk about all the negatives, all the stuff I'm struggling with, the depressing stuff I've been talking about, and just get it out. I think I just have these thoughts every day and I never talk about them because nobody, my mom blames me for having them, so I can't talk to her about any of this stuff. She gets pissed off, like, if I am hurt, it's my fault. Like, I can't even tell her about work because, like, if someone treats me poorly at work, it's my fault. If someone bullies me, it's my fault. Like, if I was dating a girl and the relationship didn't end, then it'd be my fault. Anything bad that happens to me has to be my fault. It can't be like bad things in life happening to me, because that would make her uncomfortable, that bad things could just happen to her son. So rather than deal with that fear, she's like, I'll just blame him. And then I can say, well, if he just did the correct things, then he wouldn't have these problems. So it's his fault. So now I can just not feel bad about it. Never minding the ethical and moral consequences of doing that to your son. You're really blaming him, victim blaming. So that's my mom. My grandmother is much more compassionate. She actually showed concern about me. God, I need to shave. This is awful. So that's interesting. It's weird having someone show some concern, like in my family. Like, my dad just tells me to stop feeling bad. My mom blames me for it. They're retarded. It's the best way I can put it. And then, but yeah, my grandmother's only one in the family, but at least has somebody that is concerned about me. Or at least says they are. Aside from my mom and dad, but then I can't talk to them because of the reasons I mentioned. It's horrible. So yeah, I think that's everything. The whole depressing pile of shit. So that's what's going on with me. I'll let you know how things go with, like, the posterior stuff at Regenix, if I can do that. If not, I don't know what I'll do. Just try to get another job, I guess, and try to save up money so I can get treatment. I try to tell people to fireworks, avoid them, because although my tinnitus isn't caused by hearing loss, I met a lot of people in tinnitus support forums where it's because of hearing loss. So I tried to tell a lot of people on Facebook not to fuck around with, like, fireworks that you set off yourself. Like, don't, or like, if you're gonna set some fireworks off on yourself, like, wear hearing protection. Then if, like, they go off before you can get away, then no problem. And definitely don't set fireworks off near or on someone as a joke, because that's fucked up, So hopefully people were safe, and I hope you guys are doing better than me. So see you around.